Hey guys, I wanted to talk a little bit about breastfeeding your baby. Now, when your baby's first born, you don't have breast milk yet. You have what is called as colostrum for the first 2 to 3 days. Now, the baby's stomach is about the size of a penny. So even though you may not be seeing milk when you squeeze, it's okay. You have something in there, colostrum, which is the healthiest thing a baby can get. Colostrum helps fight infections, and it's specially made from your body to your baby. Now, as long as you feed the baby every 2 to 3 hours, usually I'd say minimum of 20 minutes, the milk should come in about 3 days. And when it comes in, you know it's in. Now, a lot of parents go, oh, no milk, I have no milk yet. The baby usually has to have a good suck for at least 5 minutes for the colostrum to start coming out. So if you squeeze, you may not see anything, so don't get turned off. When the baby sucks, the baby needs to take more than just the nipple in their mouth. Needs to take the dark skin around the nipple, at least about an inch of it, into their mouth. Now, when the baby breastfeeds, they should latch good. A good latch is very important. When they latch, again, at least about an inch of the dark area around the nipple, which is called the areola. Now, when they latch on, their tongue should be down like this, okay? And you should feel pulling. If it hurts, that means the baby's not latched correctly. An incorrect latch is gonna mean that the baby's not getting enough milk. So what you need to do is break the seal. You put your little pinky finger in the corner of the baby's mouth and it'll break the seal, and then you try to get the baby on again. Now, you can't force anyone to eat if they're not ready. So once that baby is born, do skin to skin. Let the baby start sucking, start looking for something like this. Nice and wide and open. Okay, and then you can try to see if you can get the breast into the baby's mouth. Now, you know your baby's getting enough of the colostrum or the milk if the first day the baby's born, the baby pees about 1 time. The second day of life, the baby pees about 2 times. And the third day, about 3 to 4 times. Then usually the milk comes in and you just pretty much lose track of how much the baby's peeing. That's how you know the baby will get enough. Now, some babies get what they call nipple confusion if you decide to supplement with a formula. The way the baby sucks on the nipple is different than the way they suck on your breast. But sometimes you're so exhausted from the breastfeeding and giving birth that you don't have the energy to feed the baby constantly the breast. This is what I tell my mothers. At least get 5 to 6 good breastfeeds in that you feel confident the baby has it down pat. And if you need to introduce a bottle, do 1. Don't give too much. Give maybe about 10 to 15 mLs of the formula. You don't want the baby to get too used to a lot of milk yet because you haven't produced enough yet. So then the baby, when you try to breastfeed the next time, is not going to be satisfied with the breastfeeding. So if you need to supplement because you're exhausted or whatever the case may be, do the 1. And then the following time the baby's due for a feed, breastfeed to see if you're going to have complications getting the baby back on the breast. Don't introduce a bottle back to back for every feeding because it's going to be harder to get the baby to learn how to breastfeed or to get it down packed. Now, skin to skin is very important after birth. That first breastfeeding after they're born is very important. It'll determine how well the baby usually does for the remainder of the first couple of days of life. Remember, it's new to them, it may be new to you. Don't get frustrated. If you find that you're frustrated and the baby's crying and you're just overwhelmed, just take the baby's shirt off, take the hat off, put the baby on your chest, rub the baby's back. If you keep anyone awake long enough, they will eat, okay? So the trick is to keep the baby awake and calm. And when the baby starts opening their mouth, then you try to see if you can breastfeed the baby, okay? Don't force the screaming baby to latch on, or if the baby is not looking for something to suck, don't force the baby to eat, okay? Because you're only going to get frustrated. Breastfeeding is hard, but once you get it down packed and the baby gets it down packed, it is well worth it. Breast milk is ready wherever you go. You don't need to prep it. You don't need to worry about what temperature it's at. It's exactly at the right temperature for the baby, and it's what the baby needs for survival. Okay, if you have a preterm baby, your body makes what the baby needs. Breastfeeding is so beneficial. It helps fight infections as they get older. They have less episodes of colic episodes, because it's easy for their tummies to digest. Formula is a lot thicker. It's very hard for some babies to digest it. Some moms who formula feed have to go on special formula diets for the baby, which it could be very expensive. So if you can breastfeed, it's so much healthier for the baby. Please subscribe below if you like the channel. I will discuss breastfeeding a little bit more in my next posting, and I want to go over positioning for breastfeeding. One last thing with the breastfeeding: when you try to breastfeed the baby, remember, I see some parents breastfeeding their baby and the baby's head is like turned sideways. Do you eat your dinner sideways? No, you have good body alignment. So consider that when you're breastfeeding your baby. Look at the baby's position. The baby may not want to suck if the baby's uncomfortable. Who eats uncomfortable? I mean, you don't eat on the toilet, do you? With your head tucked down like this, or your head to the side. You want to be comfortable. Comfort is everything when you're breastfeeding, for you and the baby. Again, subscribe below. Baby Nurse Angela, signing off.